and I'm one of the town's COVID-19 case managers. We're looking forward to sharing updated guidance and guidelines and answering your questions submitted in advance. You can type your questions in the Q&A throughout this webinar, and we'll do our best to answer them, or we'll follow up with you directly. It's my honor to introduce the speakers. Jennifer Murphy has served as the Director of Public Health for the town for 17 years. Prior to that, she worked for the Massachusetts Department of Public Health with a focus on environmental health with the Childhood Lead Poisoning Prevention Program and the Division of Community Sanitation. She has a master's in public health from BU. Jennifer Markham has been working in the Winchester Public School District for 11 years. She served as the school nurse at Vincent Owen prior to becoming the district nurse leader and the Winchester High School nurse. Prior to joining Winchester Public Schools, she worked at Winchester Hospital as a pediatric nurse. Both Jens have become COVID experts and are ambassadors in keeping our community and schools healthy. They continue to collaborate and lead their dedicated teams through the challenging and changing pandemic landscape. I am turning it over to Jen Murphy to start the presentation, and I'd also like to thank WinCam for hosting us tonight.
Great, thank you.
Welcome.
And welcome everyone. We are going to now turn to our slides, and just to let you know some key areas of focus for this event, we're going to review a snapshot of Winchester's COVID data, talk a bit about vaccines, testing, isolation and quarantine protocols and guidance, as well as touch on masks, and then end with a question and answer period. For those of you who already submitted questions, thank you, but there is still time as well for those of you who would still like to ask a question as well, and you can do it now. So let's advance, oh thanks. So let's look at the cases since the outset of this pandemic. So this is really 2 years worth of data. As you can see, it's a month-by-month breakdown, and this covers PCR or official cases. It does not include home tests or antigen tests conducted in the house, and it also doesn't include antigen tests results from medical sites. So this is really just looking at PCR tests over time, but it does tell a story. And what's striking about this, as you can see, November and December at the end of last year, the case count really surged, and it was something like we have never seen before in the pandemic. And so what does that do to, as we all know? It's due to the Omicron variant. We've had several variants of concern since the outset of the pandemic, and right now we are in the midst of the Omicron, dealing with the Omicron variant. So while our case count seems very high, and it's high across Massachusetts, it's high across the country, Winchester is no different in that regard, it's important that we also give context to this incredible amount of cases that we are experiencing right now. And so we'll highlight some of that context in a minute, but I just also want to say that the data that you see here really just tells part of the story, Winchester's story that we display on our dashboard. But know that there's a lot of other data out there, including home tests that we are not fully aware of. So my point is that there's a lot more disease out there than we are actually aware of. But again, if you look at the data, it does tell a story. And this is important to note that, again, while we are experiencing our largest number of cases to date, there is actually good news around this. While people are getting ill, the likelihood of getting severely ill is much, much less. And we'll get into those reasons why as well. But again, another snapshot into our data in Winchester, you're looking at a week-by-week case count, and this is what you will see on our website. And this includes official PCR and official antigen tests. It does not include home test results. But again, it tells the story of what's happening in our community. You can see starting in about mid-December, we really started an uptick in cases due to Omicron, and we really peaked in early January. It seems like we are on a little bit of a downward trend here. Hopefully that will continue. our data is mirroring what's being experienced across the state and across the nation. We knew we were going to peak, it was going to be a dramatic uptick, and now we hope to see this downward trend continue as well. Just a quick look at our positivity rate. Again, something that we have not seen since the beginning of this pandemic in 2020. We are now a little bit over 12%, and this is a rolling 2-week data set. You can see that we are not quite at the state's positivity rate of a little over 20%. However, our positivity rate is quite high. What I also want to note about this particular slide, however, is the total number of tests that our residents took. So 6,800 total tests were taken by our residents. These are PCR tests, reported PCR tests. And so that is a record number, actually, that we are seeing. And obviously, people are very concerned about their health status. They want to find out information about whether or not they have, in fact, contracted COVID. So obviously, testing is a great tool to do that. And we can talk a little bit more about testing in a minute as well. And this is just a comparison of the surrounding towns and our positivity rate. This is also published on our dashboard weekly as well.
So this slide is a copy of our Winchester Public School COVID-19 reporting dashboard. And this is on our district website. We do update this very often. It's a report or a snapshot of the current counts of positive cases amongst our Winchester Public School students and staff who've tested positive for COVID-19. It is important to note that as of January 3rd, we started adding reports of positive self-administered home tests to our data. So, and we all know that we did have quite a bump in cases after our December break, and that is due to gatherings and travel and just the surge that we saw in the state. So we did definitely experience more cases, particularly at McCall and the high school. So this is, again, updated often, and this number is reflective of today.
So where are we going? We are actually moving into a period of time where we are shifting responsibility for managing this illness back onto people. So people need to take personal responsibility and practice, the best mitigation strategies they can to reduce risk. We know that COVID-19, as far as we can tell, is here to stay. So it's important that we learn how to reduce our own personal risk and thereby protect the people around us as well. And so we know we have the tools to do this. And so hopefully many people are taking advantage of those mitigation strategies, and we can talk about what those are individually. But just know that there is less government intervention, less health department intervention, although we still are following up cases, but just we have scaled back. It's to a lesser degree. And really we're shifting this burden onto people themselves, actually. And so we're helping guide you on what those best practices are, and we'll continue to educate and focus really on keeping our schools going, keeping our daycares open, and congregate settings, nursing homes, etc. But really for the individual person, you need to be responsible on how to stay safe and keep those safe around you. So how do we do that? Vaccines are our best defense. They help prevent serious illness, hospitalization, and death. And we will go on to show data that actually displays that and backs that up. And so we know that vaccines have been available for a little over a year now, which is such good news because we are faring so much better with this variant than we have previously. So we know that the Omicron variant is overall more mild than, let's say, the Delta variant was. However, the vaccine is providing that extra layer of defense that we all really need, because You will experience illness still if you contract the Omicron variant. Overall, it's more milder illness, but yet you still are sick. So the goal is to keep people from getting severely ill, from becoming hospitalized, and from dying. And we know, based on data, that vaccines are the best way to do that. So we know that our town actually has an incredible vaccination rate, and we can talk about that in 1 minute. But I just really want to hammer home that, you know, it's not necessarily inevitable that everyone needs to be sick. Just keep that in mind. We do have the tools at our fingertips to stay safe. I know that people right now with such widespread illness do feel, at times I've heard people talk about it being, you know, oh, it's inevitable, I think I'm going to get ill. While transmission is quite widespread, you still need to be, you know, protective of your health, again, and those around you, and definitely take advantage of the vaccines. Yep, we can go to the next slide. Now, just of note, vaccines don't necessarily prevent you from contracting the virus. I want to be clear because I do hear that from time to time. Oh, you know, someone will say, I didn't expect to get it. I had, in fact, I'm fully vaccinated. I've had 2 doses. But in fact, it doesn't necessarily prevent you from contracting it, although it does greatly reduce your chances of contracting it. But the point is, the vaccines will prevent the really severe illness that we were seeing prior to the onset of vaccines. And so if you look at this slide, you'll note our vaccination data. And as a town, we are extremely well vaccinated. You'll notice that this is a breakdown by age. And for every age category, we are doing very well. And these are all the age groups that are eligible for the vaccine. We have obviously a little bit more work to do to get the 5 to 11-year-old category fully vaccinated with the 2-dose series. And that's certainly something we can work on. I think our next goal is to really try to increase the number of people who take advantage of the booster doses. As you can see in the column all the way to the right, the last column, there's certainly room for improvement. We are offering booster dose clinics at the health department. We had 2 in November, 1 in January, and we're going to have 2 more in January. And those will be open to anyone 12 years old and older. So hopefully we'll see those numbers of 12 to 15-year-olds who have received their booster dose increase as well. I just want to make one note about this slide. You'll notice the total population on the bottom row, total number of people. That's actually out of our entire population. So while our fully vaccinated individuals says 86%, that is out of our total population, not just out of the eligible population. So if you calculated it based on total number of eligible people, our percentage would actually be much higher for those who are actually fully vaccinated. So this slide, while it seems a little bit busy, I think it's important just to focus on what this is saying. What it's saying is unvaccinated people are more likely to contract COVID than vaccinated people. And while we do have a very highly vaccinated population in Winchester, there are those who remain unvaccinated. And I really do want to stress that the likelihood of contracting COVID is much higher. Your risk of becoming severely ill is much higher, as well as your risk of hospitalization and even death. So this slide, if anything, just highlights the difference between vaccinated and unvaccinated people and contracting COVID. The dotted lines on the top are those that are unvaccinated, and the solid lines at the bottom are vaccinated people. And so you can see the dotted lines have a much more erratic pattern that highlights how frequently they have contracted COVID, or the number of people who are unvaccinated who have contracted COVID. And this is published by the CDC. You'll note that they say there is a 5 times greater risk of testing positive for COVID-19 amongst unvaccinated people. and a 14 times greater risk of dying from COVID amongst unvaccinated people. So what happens in a highly vaccinated population? This slide discusses breakthrough data, and it's a count of all breakthrough cases to date. So really about a year's worth of data, since people were considered, quote, fully vaccinated with the primary series of the COVID vaccine. So of those people who are fully vaccinated, and there are well over 5 million of them in Massachusetts, how many experience COVID illness? And according to this slide, which is published by the Mass Department of Public Health, it's saying that 5.1% of all fully vaccinated people are experiencing illness. And that may be a slight undercounting because we now are, home testing is quite prevalent right now, and those results are not officially reported. But you can see that, again, it does tell a story in saying that there is, while there is a risk of breakthrough if you're fully vaccinated, that number is quite low overall. Now, what happens if you have a breakthrough case of COVID? This slide also gives you the hospitalization rate amongst cases, and you can see that it is under 1%. And the slide also gives you the percentage of deaths among cases. So of the people who are fully vaccinated in our state, how many of them are being hospitalized and how many of them are experiencing death? And this slide helps tell the story of why vaccines are important. It's telling you that we are experiencing far less hospitalization and death if you're fully vaccinated. So the data is here to prove that vaccines really truly are our best defense. And on the whole, again, of those cases that we at the health department are following and aware of, overall people are experiencing a more mild illness than they were experiencing for the Delta variant. When I say mild, obviously there are varying degrees of mild. However, on the whole, people are faring very well if you're fully vaccinated. Now, we say fully vaccinated, but really I should be saying up to date. Up to date on your COVID vaccines. What does that mean to be up to date? What it means is you've received all recommended COVID vaccines, including any booster doses for which you are eligible. So right now, anybody 12 and older can receive a booster dose. That means you are eligible to be up to date on all of your vaccines, and you should take advantage of that. Now, for school purposes, fully vaccinated, there's a different definition. For school purposes, within the school setting, you are considered fully vaccinated if you have had your primary series of the vaccines, meaning 2 doses of Pfizer, 2 doses of Moderna, or 1 dose of J&J. Of course, Moderna and J&J, you have to be 18 years or older. Pfizer, you have to be, you can be 12 years and older. So it's important to note the distinction. When we say up to date on vaccines, just note that it is different. It is differently defined in the school setting for school purposes. So a plug about our upcoming vaccination clinics. Right now the links should be up online and live for people to register in advance, and you do need an appointment to attend one of the 2 clinics on January 24th and January 31st. Those will be held at the Jenks Center, and they're for anyone 12 years old and older. So please do take advantage of that. We will be sending out notice throughout the schools so that the parent community is aware of that, to sign their children up who are 12 years old and older, because again, we can do much better in getting the booster doses out to people in that age group. And also know that there are other opportunities to be vaccinated. For example, Medford has allowed Winchester residents to attend one of their vaccination clinics during their walk-in hours. And they do have this weekly, and it is open to anyone of any age, 5 and older. They have Pfizer, they have Moderna, They will start you on your primary series if you need your first dose, your second dose, or a booster. So please go to our website that's noted there, and you can find the information for the sign up for Medford as well. And there are obviously other opportunities for vaccination, but I just note Medford nearby as they are allowing us to take advantage of that. And so as demand warrants, we will certainly be open to holding more booster clinics, but for now we have these 2 dates set in stone and would be more than welcome to hold more. So what's another layer of protection for us? It's testing. And there are different kinds of tests out there, and we can explain the difference between them very briefly. So we have the molecular tests, which are often collected from the nose, or they can also be a saliva test. And what the molecular test does, or commonly known just as the PCR test, what that does is it detects the genetic material, the RNA of the virus. So it's able to pick up very small amounts of virus. And so it has a very low chance for false negatives, including among pre-symptomatic and asymptomatic cases. That's why it's really the gold standard of tests available to us. And so what's an antigen test? An antigen test is swabbed from the nose, and it detects protein on the surface of the virus. And it's most effective when people are symptomatic or they have higher viral loads. And so an antibody test is really, that's a blood test, and it really shows antibodies that are produced by a person's immune system to help fight the COVID infection. So really, if you're looking to find out if you're positive or negative, you are not going to get an antibody test. What you want to find out is if you are actively infectious, you would go for the PCR or the antigen tests. And obviously, there are some pros and cons to each, and we can talk about that. We are also going to talk a bit about self-tests or home tests.
So self-tests are a useful tool to someone who is experiencing COVID symptoms. It's a great way for someone to know, before going to work, before going to school, that's experienced symptoms if they're positive. So we know that people that test positive with a home self-antigen tests should immediately consider themselves a positive case and start to isolate and notify their close contacts. So it's very important that as a tool to kind of see if you are, COVID positive, start with that. Again, isolate, notify your close contacts, stay home from work and school. And these individuals that test positive with a home test do not require a PCR. If you're symptomatic with a home test, we consider you a positive case. Home tests, as we know, do have some limitations. Therefore, people who test negative on a home test who are experiencing COVID symptoms, we strongly encourage you to retest with an antigen test 24 to 48 hours from that negative test, or consider a PCR test. And this is likely, again, as Jen just mentioned, this is likely due to the possibility of a false negative if you have a lower viral load. So just to kind of recap about self-antigen tests, we know that the benefits certainly are that it's quick. It's easy to administer, although you do have to read the directions carefully to follow different tests. I've experienced with home tests that I bought, different tests have different instructions, so it's very important to read the instructions carefully. Relatively inexpensive. They are fast. You get your results quickly, and that way you can immediately isolate and notify your close contacts. So if you have a child that has a positive home self-test, you would know to just start isolating your child, not send them to school, and notify certainly the school and close contacts. Limitations to self-antigen tests, again, as we're talking about, they do work best with symptomatic individuals. We do not share these results with the health department. They are not captured in the DPH data. It is very important, though, that parents or people that work for Winchester Public Schools or their community, if your child attends public schools, to notify our schools so that we know that your child is positive. And we do have a form on our website to report positive home tests among our staff and our students. So again, it's just to reiterate that these are great tools. They are quick, easy to administer. We do want to reiterate that the gold standard is still the PCR. So with that, I just want to talk about Winchester Public School as another layer of our mitigation strategy. We continue to take advantage of the free testing program through DESE, and part of our testing is surveillance testing. And again, last year we called it pool testing. This year it's referred to the COVID safety checks. And this is open to all Winchester Public School District students and staff. The pool testing, the COVID safety checks, does utilize the PCR test, which again we know is gold standard. At this point, we have more than half of our elementary school students participating. We continue to strongly encourage our middle school students and high school students to participate. We do keep data on our dashboard of participation rates by school, so that again is updated fairly often on our website. We did see a bump in participation, particularly at the high school after coming back from our break due to our surge of cases. So that was encouraging. I know that we're very lucky that we have a lot of parental support, parent associations encouraging testing through newsletters and emails. I happen to be working at the high school, and we make a lot of announcements overhead to remind students and staff to remember to pick up their safety tests and to return them. And we also publish in our daily notes home to parents and guardians. So for types of tests, McCall and the high school, as well as our Winchester Public Schools staff and teachers, we utilize a take-home nasal swab test by Veritas Lab. And it's a nasal swab that you perform at home and then bring it back the next day. In our elementary schools, our safety checks are conducted by trained staff through CIC, and they actually swab the younger children. Again, our participation's fairly high at the elementary schools. I do want to reiterate that if your child or you as a faculty staff member are participating in our surveillance testing, it is important to look for emails. That is how you are notified if you are a positive case. So it's important to look for emails for Veritas Lab or from CIC. So where we have surveillance testing offered for our asymptomatic, it's geared for asymptomatic. We do have a test and stay program that we are very proud of. And I'm sure people have heard a lot about our test and stay program. And again, it's a program that we offer students that are considered close contacts to a positive case that are also not vaccinated, unvaccinated. So DESE recently presented data that they just published reporting rates of positive tests among students among districts that are participating in the test and stay program. And they reported out that 90% of the tests are negative. 90% of the time the tests are negative. And our data we just were able to review as well, and what we found that only 1.1% of tests from our test and stay program were positive. So Winchester Public Schools is currently exploring the new testing options that Governor Baker and DESE announced on Monday. And the option that is on the table for districts is to offer home testing, and it would allow students and staff to do a home antigen test weekly. So although there are many more details that we need to work out with DESE, should we choose to go that route, the idea is that we would continue our surveillance testing, which is our COVID safety checks offered, once a week at every school, again, for the students and staff. And in addition to this, if we do participate, parents and students, parents that opt in for their students and staff members would be given a home test. So the idea is if you're tested, for example, on Monday, we have our safety checks at Morocco. So if you're participating in the Monday safety checks at Morocco, ideally you would test again with your home test later in the week, Thursday or Friday. Part of this program also would be to explore the idea of symptomatic testing. We actually do currently offer symptomatic testing for our staff. So this, we would explore the idea of performing antigen tests on students that are exhibiting symptoms during the school day. And the idea behind that is because we could identify a positive case kind of right point of care. And then we could offer parents and guardians information, your child just tested positive and this is what you need to do. So it would be very advantageous to know a positive case sooner than later. It's important to understand though that symptomatic children, if a nurse is evaluating and a child is presenting with symptoms, that symptomatic child would still need to go home, but we could, with parental and guardian permission, perform an antigen test, and then again, the child would still be dismissed, and ideally, if DESE provides the home test, we could give the guardian or parent the test to perform again. Again, remembering that if you test negative with symptoms, it's very important to test again within 24 to 48 hours. With this new program that DESE is offering, the districts that participate in the new program would discontinue test and stay in schools. But this does not mean that the school nurses and the health department would not be paying attention to cases. We would still be focusing on cases at school, looking for potential school spread.
So let's talk about community testing that we are offering. It's the PCR testing clinics that are offered twice a week at Town Hall. These clinics are open to Winchester residents, anyone who works in Winchester but may not necessarily be a resident, and open to any town employee. And obviously the demand is very high right now for testing. We have many people taking advantage of this, which is good news that we are able to offer this. I would note that we have increased our capacity and the number of appointments that we offer, so that while we are holding 2 clinics weekly, up from 1 just a little while ago, we have also increased the number of appointments for each of those 2 clinics. And you can see the numbers here, the number of clinics we hold every month or have held, and then the number of individuals tested. And boy, has that number really increased. And I would just like to say thank you to the whole testing team for being able to do that. And for the month of January, I just want to remind people that the testing clinics are in fact free. And if I could note that if you do make an appointment but are unable to actually go to the clinic, could you please go online and cancel that? There is such demand for an appointment that as soon as you cancel that, the space will open up and someone else can grab that appointment. Now, who are the testing clinics recommended for? Who is PCR testing recommended for? First and foremost, symptomatic individuals. If you don't have access to a home test or an antigen test, or would just otherwise prefer a PCR test, please take advantage of the weekly testing clinics in town. So again, symptomatic individuals, highly recommended for. If you've been exposed to someone who tested positive, for example, someone in your household, you would want to take advantage of the PCR testing as well. Obviously, if you're going to visit with people who are high risk, if you're going to visit grandma, if you're going to visit someone who is immunocompromised, it is also a good idea to receive a test. And then if you're going to have a medical procedure as well, oftentimes you're required to get a PCR testing. In general, those medical facilities do have the ability to help you with that, but if that is not an option, feel free to take advantage of our testing clinics. We have heard you and did, in fact, mitigate the amount of people that were that had to wait outside and we didn't want to create crowded quarters inside Town Hall, so we have created quite an extensive area for people to be able to wait safely inside at Town Hall. And you'll see on this slide the upcoming clinics that we have scheduled. And as those time slots fill up, oftentimes we do add on to them. So we do keep track of that as they fill up to be able to extend them and offer more appointments. And those will continue indefinitely, but again, for the month of January, they are in fact free. Otherwise, after January, they'll be $20, except free for town employees. Now we can talk a little bit about isolation protocol and what the current guidance is. And it did change at the end of December. As we all know, the CDC did issue some new guidance, which the Mass Department of Public Health did adopt. So let's talk about isolation. And please don't forget that. Isolation means you are separating yourself. You, the individual who has tested positive and are sick, you're separating yourself from those who are not sick. So really doing your best to try to stay away from people, especially in your household, because you're trying to limit the transmission of that virus. And so what happens if you do test positive? And again, this could be on a home test, home antigen test. This could be on a PCR test. If you test positive, you need to stay home for a minimum of 5 days. And really, this is a minimum. We know that people can still be infectious up to 10 days after symptom onset. This has not changed. This is what we know. This is the data that we have collected since the outset of the pandemic. So 5 days is really a minimum. What do you do next? You notify all your close contacts, and the definition of a close contact hasn't changed. It's those people who were nearby to you within 6 feet for more than 15 minutes. And so you want to notify those people so that they can be on the lookout for symptoms and get a test as well. Now, if you have no symptoms or your symptoms are largely resolved after 5 days, you can then leave isolation or leave your house, but you still have to mask for the remainder of the 10 days, which would be another 5 days. Obviously, please, again, before you leave the house and take yourself out of isolation, your symptoms need to be mostly gone. Really, when you're symptomatic, the likelihood for transmitting the virus is much greater, and we're trying to avoid that. And with Omicron, we know that is much more transmissible than even Delta was. So knowing that the transmission is very, very likely, you need to really take the precautions and protect people around you. Make sure that after the 5 days, you do not have symptoms. If you continue to have symptoms after the 5 days, please continue to isolate. You need to be fever-free at least 24 hours without fever-reducing medication. You should really be experiencing no more sore throat, no more headache, no more or greatly diminished cough. And so again, please stay at home if you're still experiencing symptoms after 5 days. But 5 days is in fact now the minimum for isolation. And it's very important if you do leave your house again after the 5 days, if you're asymptomatic, to still when you're around people, wear a mask.
So due to the fact that we know symptomatic individuals are more likely to continue to spread the virus to others, as a district, we made the decision to clearly define what symptom resolution is for returning to school. So we did, kind of carve out what symptom resolution is for parents and guardians. So for Winchester Public Schools, students must meet the following criteria before returning to school. And if a child does return to school too early with symptoms, they will be required to be picked up. And again, this is a mitigation strategy that we've had from the onset of this pandemic. We really want ill individuals to stay home from school. So again, and Jen just ran through these as well, but again, it's no fever for 24 hours, and that's without Tylenol or Motrin, free of runny nose, free of sore throat, free of headache, and a greatly diminished cough. So if your child is on day 5 and you're evaluating if they are ready to go back on their 6th day, it's very important to, really make an assessment and make a judgment if you think that your child has, symptom resolution. And it's okay if they need another day. It's very, very important. We're trying to keep spread, low in our schools. So if you think your child needs another day, you are really making the right decision for the school community. And I know that people do worry about, especially with kids that are older and missing school, but as a district, we have always, supported this mitigation strategy, and I find our faculty and teachers very, very supportive when children are staying home due to illness. So for the older kids, it's important to just communicate with teachers. And overall, everyone will be thankful for following these guidelines.
I think if I can just tag on to that, Jen, I think what's another important point to make is that we're still trying to protect those that are vulnerable in our community, right? We know that people who are in a high-risk category, immunocompromised, elderly, that they have a much tougher time dealing with COVID. They are subject to more severe illness. So we're trying to really be most protective of those folks in our community who are most vulnerable to serious side effects of COVID. So please keep that in mind when thinking about your isolation and when it's safe for you to leave your home, because you really do want to try to limit the transmission of this to those who cannot fight it as well as perhaps you could have. So please just be mindful of that. Thank you. Oh, that's our COVID team. So there are the folks that are working round the clock very hard for you in the community to try to impart the information that you need around isolation and quarantine, as well as helping us out with our COVID testing clinics. And this will be up on our website for you to see as well. I think I was supposed to remove that slide, but it's up on our website. It's good to put a face to a name. So therefore, if you get a call or an email and you see a name, now you will have a face with that name, and you can go to our website to look at our case management team at your leisure. So now let's talk about quarantine, or when someone is exposed to a COVID positive person, what has to happen? So quarantine means that you are separating yourself from people because you have the potential to develop the illness. So until that happens, you want to take precautions because you're not, you may not be aware when you are actually become infectious. You may not have symptoms. You may be infectious prior to symptom onset. So if you are exposed to someone, there are some things you need to do. But it depends, and just to make it tricky and keep us all on our toes, it depends on your vaccination status. So if you are up to date on your COVID vaccination, there's no need to quarantine. And again, we mentioned, what does up to date mean? It's whatever vaccine you are eligible for on the COVID schedule, and you have taken advantage of that, you are up to date. For example, myself, I was eligible for a booster months ago. And so I did eventually take advantage of that. I am considered up to date. And if I were exposed to someone who has COVID, I would not have to quarantine or stay in my house and separate myself from others, but I would want to monitor myself for symptoms, and I would want to mask around others for up to 10 days. Now, if you're not up to date on your COVID vaccinations, what do you need to do? You need to stay at home and quarantine for 5 days, followed by strict mask use when you are out of your house and out of quarantine for an additional 5 days, because again, it could take up to 10 days for the infection to become apparent. So again, it depends on your vaccination status. If you are up to date, no quarantine needed. If you are not up to date, quarantine is necessary because you could develop the illness and spread it. Now, it's important to note that, that students, Winchester Public students, with an out-of-school exposure, you must quarantine if you haven't received your primary 2-dose series. So again, it's this difference between how do we define vaccinated or fully vaccinated. In the school setting, it's different. So let's take an example for the school setting, or the school example. If I'm a mom and I become positive for COVID, now my young child in my house, let's say my 10-year-old, is now exposed. Or let's say 12 years old. Let's use that. 12 years old. 12-year-olds are now eligible for a booster, but again, for school purposes, fully vaccinated means they've had the full 2-dose series. In this instance, my 12-year-old has in fact had the full 2-dose series of Pfizer. My child is considered fully vaccinated for school purposes and can continue to go to school as long as my child is not symptomatic. So it's a very big difference. It's a very big incentive, another incentive to become vaccinated, because you don't have to quarantine, your child doesn't have to quarantine or stay at home. Did you want to add anything to that, Jen, or you?
Yes, definitely. So the out-of-school exposure with a student that is not vaccinated fully, we do require a form to be filled out. And again, we have a separate form. So we have a form for students that test positive. And again, the purpose of that is so we can keep track of the students and their attendance, and there's communication with the health department. And this is another instance of reporting to the schools that if you have a student with an out-of-school exposure and is not vaccinated or not fully vaccinated with the 2 doses, please fill out the other form on our COVID resource page on our website. And again, this will prompt the health department to reach out to you and give you quarantine information. And it's also important information because we do, strongly encourage unvaccinated close contacts to test at a certain date to make sure that they're not testing positive. So that information would be relayed through the health department.
And all of the isolation and quarantine information that you need and the guidance is on the Winchester Health Department page of the town website. So please, and it's also available on the mass.gov website as well. The Department of Public Health does have those protocols as well. And I know it can be a little bit confusing, so feel free to also reach out to the health department if you do have questions. And so I was just trying to think of other examples that might help illustrate what we're trying to say. But I think the biggest takeaway from this is that quarantine really does truly depend on your vaccination status. And note that it could differ, in fact, from the definition of school as well. So it's important that if you're unsure, that you go to the right source, whether it be the Winchester COVID page or the Winchester Public School page, where you can find out the exact information.
And due to the fact that it is confusing, we did add this slide that just really reinforces the importance of testing after you've been exposed. So for anyone that is exposed to a positive person, it's important to test on or after day 5, after the last exposure. Of course, if you become symptomatic before that, you would need to test before that. But I do think it's important to note that we do get a lot of these questions from families if a parent or guardian has tested positive or a sibling. So, and it is confusing, and the nurses are, we're more than welcome to help, with families figure this out. But if your child is vaccinated with no symptoms, your child is allowed to come to school. But we do have a low threshold for symptoms. I tell people, if you wake up with, I think my throat hurts, and you've been exposed, it's important to keep your child home and have them tested. And again, this is just our mitigation strategy.
Okay, another tool that we all have to limit transmission are masks. This is our new mask sign you'll see around town. The Board of Health at the end of December did institute a mandatory mask requirement for all indoor public places. So anytime you go into a store, a business, a gym in town, hopefully you'll see the sign reminding you to mask up before you go in. And the signage also talks about what type of mask, because I think the type of mask really does matter. First and foremost, any mask you put on has to cover your nose and your mouth and should be tight fitting to your face without any gaps on the sides. Also, if you don't have access to a KN95, which are widely available on Amazon, or an N95, you could always use multi-layered cloth. It is not ideal for sure. Again, we're now having a discussion. We've evolved over time. Our discussion now is around what is the best type of mask to actually wear. And again, ideally, KN95 or N95. But if you don't have access to that, it would be multiple layers of cloth or even multiple layers of a regular face mask or surgical mask. And so when you mask up, we know it works. We know it provides a barrier for transmission. We know that it slows down the spread. We know that it's working in the school environment. And if you are interested in reading about the science behind masking, we do have that link available on the town's webpage for you. But just know that we see masks as a tool for the foreseeable future, at least in the schools. I know that the DESE commissioner did extend the use of masks in the school, which is a very good idea. And so again, there's an indoor mask mandate in place right now in Winchester, as with other towns. And that is reviewed by the members of the Board of Health at their meetings. So this is really our last slide, Jessica.
Okay. Thank you.
Hopefully we left time for questions.
Yes, I think so. Thank you. So we have some questions that have come in. The first is from a resident who'd like to know why you think that fewer families at the middle school and high schools are opting into surveillance testing, and what are the barriers to increasing participation?
That's a good question. We are perplexed by that to some degree. We did do a pilot testing program last year at the high school, and we offered testing in the morning, and we offered it twice a week. We did have similar numbers in participation. We used lots of strategies to encourage participation, even incentives. And giveaways, right? I mean, we really, and then we changed it to the first. We had it in the morning, and then we changed it to lunchtime, and it really did not change our data in terms of participation. So it's a great question. Again, it was encouraging that since we've been back from break, we have had a bump in participation. We had about 100 students since break participate weekly. So I'm hoping that continues, and I definitely encourage parents and guardians, families to have discussions at home about why it's important to kind of get ahead of it and identify cases early to stop the spread. So, we're willing to try other ideas if people have other ideas. So.
And I think both the town public health information and the school information outlines all those test procedures and gives a really good idea of what the participation would look like. Okay, so the next question is, what is the turnaround time for weekly school surveillance testing?
So that's a great question. The surveillance testing is pool testing. So we have samples in a pool. So first, your pool that you're in is processed. So that's about a 24-hour turnaround. If someone in your pool is positive, they run the individual's tests separately. So it ends up being, if you're in a positive pool, you have an individual PCR test. So that is about a 48-hour turnaround. It could be, they say, up 2 to 3 days turnaround. We did see longer testing results, and that was because of the surge when we came back from school, so there was more of a delay, but the goal is to get it back 2 to 3 days. And again, it's asymptomatic testing, so we're trying to pick up people that are not symptomatic, so it's surveillance versus we don't want people to use it as symptomatic testing.
At the August 10th, 2021 school committee meeting, Ms. Murphy reported in a presentation that last school year, they only saw evidence of potential transmission in school in 5 out of 287 cases of Winchester students and staff. What has the experience been this school year so far? Have they seen evidence of transmission or potential transmission in school?
We do monitor our cases, closely, and we do look for increased cases in classrooms. And if we do feel that there's been a spread, we do up the surveillance and we kind of extend the testing. So we do look at that. And I very often, if the nurses bounce things off of me, we also include our health department on these situations.
Yeah, I
in
mean, just
terms of
from the test and
data,
state
yeah.
data, yeah.
The test and state data is strong, so out of the 1,600 close contacts that we tested, the number was 18 that tested positive, so that's where we got our 1.1. So we feel that data is very, very encouraging.
So this resident would like to know that given the CDC data has now admitted that cloth masks do not stop COVID spread, and many studies also show that medical masks do not stop COVID spread, how and when will the decision be made to, 1, stop requiring mask wearing for all students, and 2, stop testing healthy students who are not exhibiting symptoms? And by how, they would like to know what the metrics are that will be used and what the process is and who will decide.
Well, regarding the mask question, I think we can all agree, and the science is there, as I referenced earlier, that, clearly having a barrier over your nose and your mouth is a very good way to control spread. It's the science is there, the CDC has published it. So I don't think we're at a point in time where we're arguing about whether or not to mask up. Perhaps we are, in fact, talking about the quality of the mask, which truly does make a difference, which I alluded to earlier. If you can shift away from the cloth, would be preferable. KN95s like we're wearing, I ordered on Amazon, very readily available, are much more preferable and more effective. N95 even more effective. However, if you don't have access to those, there are other ways that you can be safe, like I talked about, multi-layer cloth. So that's if you have no other options. Would prefer something rather than nothing, but clearly there are grades of effectiveness amongst the other types of masks that you can utilize. And in terms of when we're going to stop, was that the second part of the question, Jessica?
Yes, when and how is that decision made? Who makes the decision?
So for the town, as I mentioned, the indoor mask mandate was voted by the Board of Health, and they do revisit that mandate. They will be revisiting it at their next meeting on January 25th. And if they take no action to rescind it, it will remain in effect until they decide to review it and discuss it again.
Right. And on the school level, our school committee, with our superintendent, makes the decision.
So another resident would like to know that some local towns are requiring children to be fully vaccinated against COVID in order to participate in sports or other extracurricular activities. Is there any consideration for this in Winchester, and are you considering other incentives to encourage those students who aren't fully vaccinated and or boosted to go ahead and get their COVID vaccine?
Yeah, that's a valid question. we're not the decision makers on that. Although I think there's certainly discussions that can be had, but I think if parents or the general public feel strongly that they feel that this is a good idea, that they should reach out to either the school committee or even the Board of Health, people who are in fact the decision makers around that. I think from our perspective, we are obviously advocating that people take advantage of vaccines and take advantage of whatever they are eligible for. And that's really, I think, well, at least from my perspective, that's my recommendation, and that's what I would say. In terms of making it mandatory or incentivizing it in that way to play sports or join a club, that's a very interesting conversation that could be had by those that making the decision.
Okay. So it appears that based on weekly safety check participation data tables updated January 9th and January 17th, that 54 positive cases were identified with the last round of testing. Were these students asymptomatic, and are the safety checks a helpful tool currently? And if so, what can we do to help with participation as parents?
I mean, we feel that it is a very helpful tool. Again, we're trying to pick up the asymptomatic cases, so we're trying to get ahead of it to stop the spread. So if we can identify a case that's positive that we would not have known otherwise, we can advise the isolation, again, not to expose other people. So we do think that it's a strategy that is working well. In terms of, I probably could look into a little bit, out of the 54 cases, symptomatic versus asymptomatic. I do not have that data in front of me. But, I have often been the one to call a parent to make sure that they've gotten the email. So I have that conversation, were
Sure.
they having symptoms and such. And sometimes people aren't aware that maybe one minor symptom could have been the beginning of an infectious period. So,
Yeah.
and that is tricky, that can be tricky.
Okay. And if a student is participating in the weekly surveillance testing and presents symptoms while at school the same day as submitting the sample for the school testing, will that test result clear them for return to school if the pool is negative?
So they're experiencing symptoms.
But the pool is negative.
Negative.
Yeah, or will they be able to come back to school? Is that their?
Right, so if someone's in the pool and it's negative, we don't actually get those individual results. We only get individual results in a positive pool, and then the lab will test each individual. So we get individual test results. So again, that's why it's important that symptomatic, you get a test that you're going to get the results much quicker, home self-antigen or a PCR, an individual PCR.
Okay. And this is one that comes up a lot on our end as case managers. If my student has had COVID and was told not to test for 90 days, should I pull them from the weekly screening tests?
That is a great question, and the answer is yes. Yes, please.
And they can go on, there's a form to do that as well, I think, right?
We do have an opt-out
yeah.
form by school on the website.
Okay. All right, and we have one final question. What is driving the health department's shift toward messaging around personal responsibility? Additionally, one of the panelists said earlier that we are moving toward less government intervention. As a former communications professional, the use of political framing is disconcerting from town staff as it detracts from the collective responsibility that we all share and must exercise to keep the most vulnerable members of our community safe.
Right, so COVID, as far as we can tell, is here to stay. And we all have to learn, I think, how to live with it and how to live with it as safe as possible. And so the emphasis when we say personal responsibility is that we really truly are trying to impart the information so that people can make the best decision on how to limit the spread of COVID for yourself, but also for the collective town, the collective society. And perhaps government intervention was not the right terminology, because certainly we keep public health in mind. This isn't any political discussion by any means. But this is a shift in Massachusetts. The governor and the Mass Department of Public Health have sort of set this new direction, because as we have to learn how to deal with it, we're going to have to treat it more as an endemic disease versus, it is still obviously a pandemic, globally widespread, but we are going to start treating it as an endemic disease and learning how to live with it and mitigate it for the foreseeable future. And I think that was just moreover my point.
Okay, thank you. Okay, well, this concludes tonight's webinar. Thank you to the Health Department Director, Jennifer Murphy, District Nurse Leader, and Winchester High School Nurse, Jennifer Markham, for being here this evening. And thank you to WinCam for hosting, and the community members for your thoughtful questions.
Thank you.
Thank you.